Hello, everybody. Yes. All right.
Wow.
Hello. Hello. We want to welcome you to our community conversation. I am going to turn over the host capabilities. Um, I'm going to leave Pastor Pam, who will do our introductions, and we'll go from there. Does that sound good?
That sounds good.
Awesome.
Okay, so welcome everyone. Welcome to our Ministers Alliance of Rhode Island Community Conversation. The community conversation is about cancer prevention, cancer education, cancer screening. We just want to educate and let everyone know that we can beat this disease. And by doing this, we need education on the cancer. We are focusing on four cancers, which is lung, colorectal, cervical, and breast. But we're also opening up for other cancers as well, as such as prostate. But we want to educate our community. So we're asking everyone on Facebook to please share. We need you to share this, and all the ones that are on now. Please share, because we want to come to our community and let them know what you can do, what you can do for your family. And so what we're going to do is we have some um, very important people that are collaborating, community partners that are collaborating with us. And we also have a survivor to even talk about their journey. And this is education, everybody. This is something that we all need to know about and that you can share with your family. We're even going to be talking about family tools. We want you to talk about this with your families, because we know about the genetics of cancer. I am that part in my family. My family, where the women have breast cancer and the men have prostate. So we need the genetics also. And this is why we need this conversation amongst each and every one of us, amongst our neighbors, family, friends, co-workers. And so we want to thank everyone for being here. And I am going to have everyone just introduce yourselves so that they know. And so you're introducing yourselves, and you are letting us know where you are from. So we're going to start with Norma. We will hear from Norma, but Norma, can you just tell them who you are?
My name is Norma Hardy. I am a survivor of ovarian cancer, non-epithelial. There are different kinds of ovarian cancer, by the way. I was diagnosed with non-epithelial ovarian cancer in the spring of 2010. At that time, I worked in research, in the area of research at Brown University, and I was relatively healthy, at least so I thought. And I'm not giving my story at this time, correct?
No, but we will call you back. How's that?
Okay, okay. Currently,
Thank
I
you
work
so
with,
much, Norma. But we will call her back to hear her journey and her story.
all right.
Next, we have our Pastor Lori Smalls.
Oh, hello, everybody. My name is Lori Smalls. I am a member of the Ministers Alliance, and I'm so glad to be a part of this initiative, which is a very near and dear to my heart. My mother died from uterine cancer. My sister um, died from kidney cancer. Um, Grandparent, my grandfather died from lung cancer. And so cancer is prevalent in some parts of our family. And so I'm so glad to be a part of this initiative. Thank you.
Thank you. And we have Eva Gamble.
Hello, Pastor Gamble, and I've gone through some of the healing process from breast cancer. And also, it has shown itself within the women in my family. So it's something very dear to me, and especially educating people about cancer.
Thank you. Thank you so much. Appreciate it. Alicia.
Hi, everybody. My name is Alicia Fernandez. I do community outreach for United Healthcare, and we've been very happy to partner with all these amazing organizations to bring out research and the conversation going about all these cancers and how we can do screenings and protect ourselves and make everybody aware how important this is. So thanks for having me today.
Thank you, Alicia. Reverend Farley.
I'm Reverend Farley, member of the Alliance. My both parents died at a very old age, but the name cancer sounds like a taboo in our community. And so I just felt I'm so glad that I'm into this initiative where because I do not know my history. And so I'm involved. And I will try to encourage others to be involved. Because what we read about cancer, you can be healthy and it just pop up. And so that's what I'm so involved.
Thank you, Reverend Farley. And we have Hamid and Ian. Please introduce yourselves.
All right. Thank you, Pastor Pam. My name is Hamid,
I'm Ian.
and we're here from the American Cancer Society at Brown, and very excited to share a little bit about our work on campus and the community, and also our screening guide, which encourages people to get screened for cancer. Thank you.
Thank you, Hamid and Ian. And we have Megan.
Hi, everyone. I'm Megan Daniel. I'm Executive Director of the Partnership to Reduce Cancer in Rhode Island, and we're very happy to be supporting this initiative. And we know and love Norma. She's a member of ours, so I'm excited to hear her share her story and hear from everyone else today.
Thank you. And we also have Sarah.
Hi, everyone. My name is Sarah Gingrich. I am the coalition coordinator for the partnership, and just excited to continue these conversations and hear some really amazing stories from people.
Thank you. Thank you. And we have Kelly.
Hi, everyone. My name's C. Kelly Smith. I am the person who manages the Comprehensive Cancer Control Program at the Rhode Island Department of Health. I want to say that I am always honored to attend these conversations and to be part of the planning for them, because I feel like we're doing something here that has not really been done on this scale in the state. And I think it's just really important. So thank you very much for doing this, and to be continued.
Thank you. And I think that is everyone. Again, we want to say thank you to everyone that is here. We do have other community partners that are with us, that is helping us and assisting us in this cancer initiative. So what we want to do right now, we're going to call back Norma, and she is going to just give us her story, because we want to educate you and let you know you're not the only one, and let you know that we can survive. So we're going to call on Norma Hardy. Thank you, Norma.
Well, thank you so much, Pastor Pam. It is a privilege for me to be here this morning to share my story about non-epithelial ovarian cancer. In the spring of 2010. And I use that to frame my story because those people from Rhode Island will remember that we had major flooding in the state. I believe at the time, the Warwick Mall had cars submerged in the parking lot. And I think the Warwick Mall had to be closed for several months as a result of the flood. And, you know, it was a very, very bad time weather-wise. So at that time, I was scheduled to have my annual exam by my gynecologist. And her office was right across from the mall. So at that time, I remember we could not access that building. So we were transferred over to Johnston. But anyway, I went in and had my annual exam. And at the end of the exam, my doctor said to me, everything looks good. And normally she would say, you know, give me a summary at the end. And she said, everything looks good. The only concern that I have is your left ovary seems a little bit bigger than the right one. And I'm saying in my head, ovaries are so tiny. What is she saying? I said, what does that mean? And she said, I'm not sure. But she said, I would like to have you do an ultrasound. In retrospect, I now know that that was a transvaginal ultrasound that she wanted me to do. I went and I did the ultrasound, and a few days later, I remember her calling me, and it's always a call, you know, and she called and she said, I got the result. Do you have a minute? And I said, yes. And she said, you have a cyst on your left ovary. She said, it's not just any run-of-the-mill cyst, it's a large cyst. She also said that there is a small hard area in the middle of the cyst. And I said, what does that mean? She said, in that area are some granulosa cells. Now, I knew nothing about tumor cells. I knew nothing about granulosa cells. But the long and short is, I was diagnosed with stage 1C non-epithelial ovarian cancer. And the tumor cells were encapsulated in my left ovary. And there was no lymph node involvement and no metastasis. I was fairly healthy. I was a health educator. I practiced my art. I worked out. My research that I worked on focused on increasing the levels of physical activity and eating healthier and all that. I never smoked, never consumed alcohol, had no symptoms at all. So there was no bloating, which is typical of ovarian cancer, no urgency to urinate, no family history of ovarian cancer, no feeling full, none of that. So I was kind of thinking, maybe that was kind of a mistake that my doctor is making here, but you know, I'm a compliant person, so I followed through. I did the ultrasound that was requested of me, and I complied. Now, give you a little bit of background. About 11 years earlier, I had a hysterectomy, and I had, you know, when you have a downtime and you can read your chart when the doctor is not really looking. So I read my chart, and I did notice that in the consent, there was a little notation of the removal of the ovaries along with the uterus and the fallopian tubes and everything. And I was saying to myself, why am I getting my ovaries removed? So I said to my doctor, why are you thinking of removing my ovaries? And she said, Norma, sometimes they cause trouble down the road. And I said, but is something wrong with them? Couldn't we keep an eye on them? And she said, yes, we could do that. So long and short is my ovaries were not removed during the surgery. My uterus was removed, ovaries were left behind. And 11 years later, here we are with the same doctor that removed the uterus. And here we are with the cyst. And we don't know if it's malignant. We don't know if it's benign at that time. So I was ready to remove my ovaries at that time. So surgery was scheduled. The right ovary was removed without incident. The left one was wedged in scar tissue. So that one broke into several pieces. It was shattered because they had to kind of chisel it out. And you should also know that I have 2 children by C-section. And when you have C-sections, you have a lot of scar tissues left behind. So that was a major problem. After the surgery, my doctor discussed that, yes, this, laparoscopically, the 2 ovaries were removed, but the second one shattered. So they cleaned up as best as they could, but who knows if that spill left behind anything, maybe microscopic pieces were left behind. We didn't know at the time. I remember my doctor suggesting, and by the way, I need to tell you that my gynecologist worked with a gynecologic oncologist. They both worked together to do my surgery. It was suggested that a precautionary chemotherapy regimen was used. But then I said, can I do my research? And then I will let you know. So I was told not to Google because if I Googled, I would see the universe and it was very scary. But I went ahead and I did my research. And I discovered that we could do labs every 3 months. And if something is found, then we could go on to imaging and so on. So I remember going back to my doctor and I said, I think I'm going to do lab work every 3 months. I don't think I want to do chemotherapy unless I know definitively that there was a spill and that something was growing. I remember my oncologist said I would do the same. And I felt very encouraged. So the labs were looking for inhibin A and inhibin B. The levels would be under 10, and those were acceptable. If they were over that, then they would not be acceptable. It would be indicating that something was going awry. So we started on that regimen every 3 months. And so the first 3 months, everything was fine. The levels were under 10. Second 3 months, everything was okay. The third 3 month, I remember the gynecologic oncologist calling me and he said, do you have a minute? And I said, yeah, is something wrong? And he said, your levels are a little bit elevated. And I said, why is this so? And he said, I'm not sure. It could be that a fragment of the ovary was left behind, and that could be triggering, this level. Anyway, he asked me to do a CAT scan, which I did, and it did come back with a spot, a little dot right where the left ovary was removed. And so my case was now a case to be taken to tumor board. Any kind of cancer suspicion or diagnosis has to be taken to tumor board. And so I said, well, can my husband and I come to tumor board to see this discussion? And he said, well, I've never been asked that before, but I could go find out. And he came back and he said, I suppose you can come. So my husband and I went to tumor board to see my case discussed. And at the end, it was determined that I would have a needle aspiration to see if what they're seeing on the CAT scan was really a return of those tumor cells. And by the way, those cells are Sertoli Leydig tumor cells. So that was one. And then it was decided that after that, surgery would be done, exploratory surgery, to clean up the area. And then it was recommended that I would be given 4 chemotherapy treatments. So yes, the needle biopsy did go well. And yes, the tumor cells were Sertoli Leydig tumor cells from the spill. I did have surgery, and something very interesting happened. Let me just notice here. The spill, remember that spill that we're talking about, the shattered ovary and the spill, because there were the ovary was shattered into several pieces. There was a growth going on in the area of my sigmoid colon. So I had to have a colon resection. You know, the gynecologic oncologist had to take out a little piece of my colon, a section, and to bring back the 2 ends together, and that had to heal. So it was good that they had gone in to do this exploratory surgery. And after healing, I started my chemotherapy, what I call the bundle. So before chemotherapy, I remember having baseline labs, and I had one of the bundles, one of the 3 drugs in my chemotherapy bundle was very, I would say, had some risks involved. That was bleomycin. So I had bleomycin, etoposide, and cisplatin. Now, because bleomycin could damage my lungs, I had to have the lung function test done before and after. And the first time they noticed that it might be affecting my lungs, that one was stopped. And I continued with the other 2 elements of the bundle. That is the etoposide and the bleomycin, not the bleomycin, the cisplatin. I still remember them, but they get a little tricky on my tongue sometimes. So that went well, my first treatment. And I was always holding my hair and wondering when it was going to come out. The first treatment, my hair was still there. The second treatment, I remember getting ready for the second treatment. And by the way, my chemo did not happen like every week. I had Monday, Tuesday, Wednesday, Thursday, Friday, and then 2 weeks off. So after that, I would have labs again to make sure that my neutrophils are at a good level. When I went back for my second bundle, my neutrophils were like devastated. They were almost all gone. so I could not have chemotherapy the second time. Normally, some people get a shot, but I was not given a shot. I was allowed to wait a week to see if the level would come back up. So I went back to work because, I felt better. I went back to work, and I liked my job then. And after a week, came back for labs, and my neutrophils shot right back up. So I was ready for my second chemo treatment. And that went well. I need to say, after the second one, I was healing for hair, and they were coming out like clumps. And so I was bald. I had agreed with my daughter to cut my hair off once that started to happen. And so she didn't even have to cut it off. I just had to do this, and it came out in big clumps. So I have a nicely shaped head too, by the way. So that was that. And my neutrophils were up. The third time when I went in, my neutrophils were gone again. And so I had to wait another week, and they came back up. So, my body's a wonderful, wonderful machine, a God-given machine. So, I'm so happy that I didn't have to get a shot to bring my neutrophils up. But the long and the short of the story is that I had the 4 treatments of chemotherapy. After the first treatment of bleomycin, I did not need to get that again because of the toxicity. I continued with the other 2 chemo drugs, etoposide and cisplatin, to the duration. And that was in July of 2011 that I had my last treatment. What I did notice, in the middle of my palms, I had a lot of neuropathy as a result of chemotherapy. And the bottom of my feet, they were like pins and needles. My nails were like they were beaten with a hammer. That's how black and blue they were as a result of chemo. I think my eyes did not look too healthy either as a result of chemo. But after a while, I noticed that the neuropathy went little by little until I didn't have them anymore. The bottom of my feet, that neuropathy also gradually disappeared. My nails became healthy looking again. The taste in my mouth, that was something that was remarkable. I could not shake the bad taste in my mouth. I even had myself scoped. I had my doctor referred me to an internal medicine physician that scoped me, and nothing was wrong. But gradually, that went too. So it did take some time, but follow-up tests were done every 3 months until that migrated over to every 6 months. And now I go in once per year, and I've been cancer-free since 2011, and I thank God. That's my story.
Thank you so much, Norma. It is a lot to go through, but we thank God that you were able to survive of everything that you went through. We appreciate your testimony, and it's encouraging for someone out there that we can go through this, and that there is a chance, a good chance, and especially surviving. And we want to thank you for taking your time to give us your your journey, and we just pray that everything stays healthy with you. We want to call on Dr. Barry Fabius, because he's going to talk about the prevention of screening. So, doctor, can you help us? Come on.
Yes. First of all, Norma, just a wonderful story, because obviously it's a story of great success, and you look great, and I'm delighted to hear that you're so far out from your diagnosis. It really bodes well that you've cured your cancer. So it's a good starting point, although obviously a difficult presentation to follow, because that was just so wonderful. But what our hope is, right, what the medical community's hope is that we catch cancers either very, 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 very early, where they're easier to treat, or even better, that we prevented cancer from occurring. And the reason that we want to push folks to get screenings is that if we do them regularly, then there's a chance that we catch these changes in the cells before they even become cancer, before we even have to start to talk about, aggressive treatments. So, for example, on colonoscopy, we can sometimes find polyps that are not cancer yet, which can be just clipped easily. And they can do it while they're doing the colonoscopy, and remove them before they become what we call malignant or become cancer cells. And these are sometimes pre-cancer, so we're getting them before they make that change into a cancer cell. So it's critical that we do these screens on a regular basis, in the hope that we are preventing and not just catching cancer early, which they also do, so that the earlier you catch a cancer, the easier it is to treat, by and large. I will share with you that perhaps the two saddest moments of my career, and I'm not a youngster, after 30 years of being a physician, the two saddest cases that perhaps I've ever had to treat as a geriatrician. Now I see older patients. So these were older patients who came to me who had not been getting regular treatment, had not been getting their appropriate preventive screenings. And they both presented with abdominal pain. And unfortunately, on physical exam, when I pushed on their abdomen, I felt the tumor. And they were in both cases, fairly large. And it was really unfortunate, because that's the point at which it's very, very, very difficult to treat. At the point at which we can palpate or feel a mass through the abdominal wall means that mass is very significant in size. And in both cases had already spread throughout the body. So that's what you do not want to do. And what you want to have happen is that, and I can't guarantee that if these folks had gotten their colonoscopies regularly, that this never would have happened, but I feel very confident that it never would have happened had they gotten their colonoscopies at the right stage of their life and followed through on all their preventive screening. So what I'd like to do, and this is the one takeaway for folks that I think would be a valuable tool. Can I share my screen? Is that possible?
Yes.
Okay, I'm gonna share my screen, and tell me if you see this. Can you see this? Did this come up?
No.
Okay, let me go back and see if I can try it again. Otherwise, I'll just talk to you about it. I'll try to share my screen again. Okay, it's not allowing me to do it. Okay, so what I'll tell you is that there is a really good resource, that most physicians utilize regularly, and it's called the United States Preventive Services Task Force. If you shorten that, it's just the USPSTF, but the United States Preventive Services Task Force. And I'll try to put this address in the chat for those who can access the chat. But the importance of this site is that it's a body of medical experts who look through all the research and data and then put forth their recommendations on what cancer screening you should do in your age group to prevent and screen for cancer. And so if you go to the United States Preventive Services Task Force site, you will find their guidelines for breast cancer screening and the appropriate timing and recommendations for mammography, for colon cancer screening, for prostate cancer screening, for cervical cancer screening. You can just click on their guidelines and you can find out what the experts are recommending. Now, I will also say on top of that, that these recommendations should be discussed with your primary care provider, with your physician, to assure that, you know, they are also in agreement with these guidelines. But it's a great starting point if you have any questions about how you can best care for yourself and your family and prevent cancer from occurring. So let me just put this into the chat. That's a site there for those of you who have access, and I highly recommend that as a tool to prevent cancer. And so if I can give you one take-home point, and that is an ounce of prevention is worth a pound of cure. And getting out there to do these tests regularly and assertively and aggressively for you and your families is critical. And, you know, the last thing that you want to happen is that you come into a physician like me with abdominal pain and a large mass that hasn't been found earlier. Thank you.
Thank you, Dr. Barry. We appreciate all that information, and we will make sure that we put that information in the Facebook chat as well, because we know that people are going to be watching later and they need this information. And prevention is critical, and this is one of our main goals, is to enhance prevention. So we appreciate you. Thank you, Dr. Barry Fabius. Dr. Fabius is from United Healthcare, and we say thank you for your time. We're now going to call on another survivor, and her name is Eva Gamble. Eva? And is she there? She's here. Eva, if you're talking, you are on mute. Okay, so we're going to go right along. Oh, okay, Eva?
Can you hear me?
Yes, we can hear you now.
Thank you so much. Well, one of the reasons I agreed to participate is that I was diagnosed with breast cancer 2 years ago, and it was in stage 0. There were 5 stages for breast cancer, but I was very surprised because at my age, I did not expect to be diagnosed with breast cancer. But I will share this. 2 of my sisters had already experienced breast cancer, and both of them had gone through breast cancer twice. And because of their history, I requested to have my mammogram done annually. The insurance company did not want to approve it, but my doctor pursued it. And so, because of the testing done on an annual basis, they were able to detect the cancer cells at stage 0, which was beneficial for me. And another thing I want to share is that women with dense breasts sometimes does not show the right results. There may be information that's not there correctly, but an ultrasound is also another option. And I do recommend that anyone who has dense breasts to do the ultrasound. That way you don't have to take one test and then another test to verify whether there's any cancer cells or not. But I was very blessed. They were able to remove the cancer cells. And my treatment plan was to have radiation and medication. I'm a woman of faith. I prayed over this. And the decision that I came to was that I would not have chemo. I would just have radiation. And they wanted to give me medication, hormone pills. And I decided not to. But one thing I did find out, not only did 2 of my sisters had breast cancer, a third one had breast cancer, and then a 4th one. My father had 5 daughters. Each of us was diagnosed with breast cancer, not only once, except for myself, but 2 times. So it's good to look at your genetic markers. Get the blood work done when you start seeing a pattern, because it will help you to do what you need to do. That extra knowledge is going to save your life, that you will do screening more sooner than what you may have done in the past. And one of the genetic markers that came up in my family was that also the propensity for colon cancer. So not only were we diagnosed with breast, but there's a probability of colon cancer. So even if you do get a genetic marker, because I have one sister that has had breast cancer 3 times, and they did it more in-depth genetic testing to find the markers, which has helped her. And her doctor had requested that other family members do the genetic testing or have an in-depth one, even though they've had the first one. This will give them more information and how to treat us as their patients. So being a survivor of breast cancer, but also I have to have an active part in the prevention for future generations and to share that information with our family line and other people that have experienced cancer. And I will say this, we are from the same parents, but our cancer was different. It may have been breast cancer, but our treatment was different. The stage of breast cancer was different. So don't believe that because this happened to this one or this is how they treated that one, it will be the same for you. I have one sister that did not take any treatment whatsoever. No chemotherapy, no radiation, and no pills. She decided to believe in God, which she should, and it's been a year for her, and there has not been any complications. But we have to be careful because cancer can spread to other parts of the body. And some people have elected to go through reconstructive surgery dependent on the type of surgery you had done, you may have your breast completely removed. And one of my sisters did that with her lymph nodes. So she has one breast totally removed, and that was her preventiveness and safety for cancer not returning or spreading in her body. But it is important to continue to get tested. And if you have any pain or indication, examine yourself frequently, but see a doctor and make arrangements. And if they tell you no, you're not scheduled for 1 year, you say, yes, I'm scheduled now because it's my body. Thank you.
Thank you, Eva. Thank you. And that is great information as well, as you talked about your journey. And it is crucial that we do have these mammograms, these screenings every year. And quickly, I just want to say, each year, you just don't know what can happen in 1 year. I had screening every year, mammograms every single year. But what happened was 1 year was different than the previous year. And that is how we can get it and get it in time. Get it in time. So we want to thank everyone here, but I cannot close until we got to hear from our partners. We thank Dr. Barry Fabius from United Health, but we also want to hear from Alicia from United Healthcare.
Hi, everybody. How are you? Just wanted to say I recently have reached out. It was great to see you, Pastor PM, and all the community partners together out at the relay. Wonderful event. Great to meet everybody in person after seeing each other on all these Zoom meetings. But recently I've reached out to the Gloria Gemma Foundation and have started working with them. And I mentioned I'm going to see if I can maybe have them join one of our Zoom meetings, but just want to share the link. They have some really great resources for breast cancer survivors. And they have a lot of classes that you can take online as far as meditation or just support needs. And they have some really great events that are coming up. So I will be sharing that in the chat. But just, as was mentioned today, the importance of knowing your background, your history. At Easter, I brought up the conversation because I was with my mom and my sister and, never knew my maternal and paternal grandmothers had breast cancer. So that's something, to be very aware of. So hopefully you can be open with your family if it's not your mom that, may have passed away or you don't have a relationship, ask an aunt or an uncle or just to know. And I also like to keep like a notebook with these different things. So when I do go to see my doctor, I can provide them that information. Sometimes they ask us those questions and you're like, oh, I really don't know. So just a reminder of that, but just wanted to say we always have resources. We're always available, myself and Panita. Panita will be joining the next couple meetings coming up. And she has a really great background as far as cancer awareness and screening. It's something that she's done in her history. So she'll be joining the next upcoming meetings, but always feel free to reach out if you need us, if you have any questions, if you need us to come table somewhere and provide information, we'd be more than happy to. Thank you.
Thank you, Alicia. Thank you so much. It was great to see you at the Relay for Life. We also have all of the information as well as resources. And now we're going to hear from Ian and Hamid from American Cancer Society at Brown University.
Yes, thank you, Pastor Pam, and thank you to everyone that showed up at our first ever Relay for Life here on Brown's campus. We really appreciate all of you coming out and supporting us. But yeah, just a little bit about us, the American Cancer Society. Us specifically as a student chapter, we're really involved in leading the cancer fight, trying to end cancer as we know it, and that's why we've really tried to work just like on campus throughout the community a lot to really work toward our mission. So a couple things that us as a student chapter, we do, we support our 4 pillars, right? In advocacy, fundraising, education and research, and patient support. So we work with the Rhode Island Cancer Action Network, part of the American Cancer Society's Cancer Action Network. We do a lot of fundraising in terms of events such as Relay for Life, such as Making Strides Against Breast Cancer. In terms of education, we try to, spread a lot of our information and resources throughout our campus, especially to college students. And for patient support, we've done a lot of volunteering at local hospitals, including Rhode Island Hospital, Hasbro Children's Hospital, and really just trying to make sure that we're contributing toward cancer support, right, for patients. And so, yeah, that's a large part of our student chapter that fits within the broader American Cancer Society organization, and we're really happy to, participate in these community conversations.
Before I have Ian tell a little bit of his personal story with cancer, we also want to echo what Dr. Fabius said about the importance of screening. The Cancer Society does have a screening guide similar to the U.S. Preventative Task Force, as well as a call information line where you can ask any questions and get the answers by certified experts, whether it's nurses or behavioral health specialists or even physicians on the line. And that line is available 24/7. So I put both the screening guide and the line in the chat. But ACS really emphasizes the importance of screening. We live in a world where 1 in 2 women and 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. And screenings are very common. They're well researched and they're life-saving if done routinely, especially when you don't have any symptoms. And this is particularly so for the 4 cancers that we're focusing on today of breast, cervical, colorectal, and lung. Screening is important for cancers that don't show up until it might be too late, and they can give you a life-changing head start for you or a loved one to begin treatment before the cancer has had the chance to spread. And the American Cancer Society, through very different community partners, collects a lot of data on the impact of screening, and we found that for cervical cancer in particular, new cases have declined in the last 30 years by about 55%. And death rates have declined even more. And same thing with colorectal cancer, with new cases declining 45%. So we emphasize the importance of screening. And so please consult your primary care physician and learn about different questions you may be able to ask your doctor. So I'll pass back to Ian to close with his story.
Yeah, so I actually, as the president of our American Cancer Society student chapter at Brown, was really inspired just by my personal story. So my father actually passed away from stage 4 metastatic lung cancer around a year ago. And that was kind of the reason why I wanted to bring the chapter to school and and build it up really. But it really goes to show the importance of screening. So, right, in getting early detection and possibly prevention, you need to get screened. And it's something that, wasn't really the case for my father. It was kind of, really exacerbated by the time we found out, and he really had a lot of, troubles in terms of just breathing, having cough. And so, right, before those symptoms even start to emerge, you want to get screened so that you can avoid those as much as possible, right? And so my pretty much urge to everyone out there is, get that screening annually or whenever is, appropriate, and it can save you a lot of time down the road, right? And it's really something that I think everybody should take into account and heed. So that's just what I have to say about screening from a personal standpoint.
Thank you, everyone.
Thank you, Ian and Hamid. We thank you. and keep up the good work. And we thank you for the collaboration with us. And we just want to thank also too, they're not online with us right now, but it was Megan and Sarah. They are from the Partnership to Reduce Cancer in Rhode Island, and they are partnering with us. Also, we have other partners. We have the Department of Health and Planned Parenthood, and then we have our churches that are part of the Ministers Alliance. Our next community conversation, our next one is going to be tomorrow, Wednesday, and it's going to be in person and also on Facebook Live. So you can't miss it. So it's going to be at the Unity Chapel Church at 16 Gansett Avenue in Cranston, Rhode Island. And it's going to start at 6 o'clock. But also, too, if you can't make it, please look up Ministers Alliance of Rhode Island. And some of us will be sharing as well. But we'll be on Facebook Live. So we want to thank all of our community partners. We thank God for C. Kelly helping us throughout the journey of this cancer initiative. If you have any questions, any concerns, any resources that are needed, please see us. Please see us. You can get in touch with us quickly with Rhode Island. No, RI Ministers Alliance at gmail.com. You may contact us with that. Also, you can contact us on Facebook. Look up Ministers Rhode Island. Just send us information, anything that you need. We are open and we are here to help and assist you. These community conversations will continue, and we are also going to be helping and assisting people. If you need screening and you don't know where to go, see us, and we will navigate you to information and resources for you. So we want to thank everybody for being here with us. Thank you, United Healthcare. We thank you, Rido. We thank everybody, Hamid, ACS at Brown. And we want to thank our survivors. Norma, thank you so much for your story. And Eva. And Ministers Alliance, we thank you too. So everyone, have a great day. Thank you, everybody.
Before we go, Miss Norma has her hand up.
Oh, I'm sorry, Norma, go ahead.
Thank you. I have a question for, Amin, was that you who presented?
Yes.
Yes.
Yes, because the incidence and of lung cancer can spread to the population, the segment of the population that hasn't smoked or been exposed to secondhand. I don't think anybody's not exposed to secondhand, whether deliberately or accidentally or but was your dad exposed directly by his smoking or his secondhand smoke?
So his father smoked for a period of time, but that was very early on and just for a small period of time. I think he also did work in the restaurant business. So he might have been exposed to various like chemical and cleaning agents there. Just right, like sometimes you have to use like really kind of strong chemical agents to clean like stoves, right, the floors. So that might have been part of it, but yeah, he never had a history of smoking himself. So yeah, definitely it can, yeah, as you said, people can get lung cancer and not necessarily have a history of smoking themselves. Yes.
Thank you.
Thank you. Anybody else have? I don't want to cut anyone off, but we also want to thank Dr. Barry Fabius. Thank you so much for coming again. And Alicia, United Healthcare, they are one of our partners. And we just thank you. And we hope to see you tomorrow at Unity Chapel. All right. God bless everybody.
Thank you.
Thank you,
Thank
everyone.
you.
Have a great day.
You too.